Imagine you are working as a medical receptionist and a patient's friend calls the clinic asking the patient's appointment details. You know the patient and you know exactly when the appointment is, but can you give the information to the caller, to the patient's friend? That is where HIPAA matters. In today's video, we are going to explain HIPAA in simple English and look at the real situations you may face in your job role. So, can you share the patient's information? Let's find out. Welcome to the Healthcare Skills Hub. My name is Nair, and if you are preparing for a medical receptionist, patient support specialist, or wheelchair medical assistant role or career, this channel is here to help you build practical healthcare skills and communicate with the patients. So let's get started. So, what exactly is HIPAA? HIPAA stands for Health Insurance Portability and Accountability Act. In simple terms, HIPAA includes federal rules that helps protect certain health information and set standards for how regulated healthcare organizations handle that information. For someone working in a healthcare supporting role, one of the most important ideas is to understand the patient's privacy. The HIPAA privacy rules protect certain individual identifiable health information known as the PHI, which is the Protected Health Information, or when it is held or transmitted by covered entities and their business associates. So the phone rings, the receptionist says, "Good morning, ABC Medical Clinic. This is Sarah speaking. This is John speaking. How may I help you today?" The caller says, "Hi, I'm calling about my friend John Smith or Sarah Connor. Anyone, can you please tell me what time his or her appointment is today?" So receptionist, "I'm sorry, but I cannot provide information about another patient's appointment without appropriate authorization. If John would like us to share information with you, he can contact the clinic directly." This is an important situation for healthcare employees to understand. You should never assume that because someone knows the patient's name, they are automatically allowed to receive information about that patient. Always follow your organization's policies and procedures. Let's talk about the PHI or the Protected Health Information. The PHI can include individually identifiable health information related to a person's health, healthcare, or payment for healthcare when handled by a covered entity or business associate. Depending on the situation, information such as the patient's name, medical information, appointment details, or insurance information may be sensitive information that must be handled appropriately. So the PHI may include patient's identifier, their health information, healthcare related information, payment, or the insurance information. The most lesson is simple. Treat patient information with care and follow your organization's privacy rules. Imagine you are working at the front desk. You leave your computer screen open while you walk away to get a cup of coffee. A patient walks past and the computer screen displays another patient's information. What went wrong? The problem is not just what you say. Protecting patient information also means being careful about how information is accessed and displayed. So, follow your workplace security procedures, such as locking your workstation when you step away. It's a simple click, Window L. That's it, it's locked. And when you're going to log in, you need a password. So, the HIPAA security rules establishes standards and safeguards for electronic protected health information. So be careful when talking. Here's another common mistake. Imagine you are speaking with a coworker at the front desk about a patient's medical condition. The waiting room is full of people, or if you are sitting in a call center setup, you have other people passing by. Even you're discussing work, you should be mindful of who can hear the conversation. So the better approach is have sensitive conversation in an appropriate private setting and follow your organization policies. So, patient's privacy doesn't stop when you leave your computer. It applies to how you speak, access, handle, and share information. So, the coworker, if the coworker says, "Hey, I saw that famous patient on the schedule today. What are they being treated for?" They might be a celebrity or a renowned person in the town. So it's your duty to say, "I cannot discuss a patient's private information unless it's necessary for my job and permitted under our policy." Even when you're curious, patient information isn't something to discuss casually. Access information only when you have a legitimate work related need and follow your organization rules. Today, much of the healthcare information is stored and transmitted electronically. That's why healthcare workers must take cybersecurity and data protection seriously. The HIPAA security rules focuses specifically on electronic protected health information and requires regulated entities to use appropriate administrative, physical, and technical safeguards. Be careful with the devices. You should have secure access, follow workplace security procedures. Let's say that you accidentally send patient information to the wrong person. What should do? What should you do? First of all, don't ignore it. So it's sent, no problem. It was sent by mistake. No. Don't ignore it. Don't try to hide it. Follow your organization's incident reporting procedures and immediately notify the appropriate supervisor, manager, or privacy or security team. Healthcare organizations have specific obligations under HIPAA breach notification rule when certain breaches involving unsecured health information occur. Mistakes happens. No problem. Mistakes happens. We are human beings. We are full of errors. We do mistakes. We are depressed of something. We are tense. We are confused. We are tired. Not enough sleep. Oh, so mistake happens, but report it and don't hide it. Patient information is private. Don't share that information with unauthorized people. Only access information you need for job. In EMRs, you might see patients pictures. They're especially in like in dermatology, in cosmetic section, they have their half nudes. But that is our responsibility to secure that information, those pictures. Only access information you need for your job. Be careful when discussing patients. Protect your computer and electronic information. Follow your organization's privacy and security policies. Report the suspected privacy or security incidents promptly through the proper channels. These principles are practical workplace guidance. HIPAA requirements can depend on the specific organization, information, and circumstances. So, can you please tell me when John Smith's appointment is? What should do? What should you do? Tell them because they know the patient's name or they are the friends. Give them the appointment time. Follow the clinic's privacy procedures and only disclose information when properly authorized or otherwise permitted. So your correct answer is option C. Never assume that someone is authorized to receive patient information. Now you have a basic understanding of HIPAA and why patient's privacy is so important to healthcare. Remember, HIPAA is a complex set of rules, and today's video is a beginner friendly introduction, not a substitute for your employees' required HIPAA training or legal guidance. If you are preparing for a medical receptionist, patient support specialist, or virtual medical assistant roles, understand privacy and professionalism is an essential part of your training. If you found this video helpful, like the video, subscribe to our channel, the Healthcare Skills Hub, and share it with someone who is preparing for a healthcare career. And don't forget to watch out our next lesson for more practical health care training. I'll see you in the next video. Thank you very much.